An aortic dissection is a tear in the body's largest blood vessel. Here's how doctors treat and manage it. The aorta has 3 layers. In a dissection, the inner layer tears and blood forces a new false channel inside the wall. Doctors classify dissections into 2 types. Type A involves the aorta near the heart. Type B begins further down. High blood pressure is the most common background factor. Aneurysms, bicuspid valves, and connective tissue conditions like Marfan syndrome also raise risk. A Type A dissection is a medical emergency. Major cardiac societies recommend emergency open surgery for almost all suitable patients. The torn ascending aorta is removed and replaced with a synthetic graft. The valve or aortic root may also be repaired. For uncomplicated Type B dissection, doctors often start with intensive blood pressure control in the ICU rather than immediate surgery. When Type B becomes complicated, a stent is placed through a small groin incision to seal the tear. This is called TEVAR. After the acute phase, patients recover in intensive care, where teams closely monitor blood pressure, breathing, and organ function. Home recovery focuses on gentle walking, protecting the breastbone, and avoiding heavy lifting. Cardiac rehab often supports this phase. Life after dissection means lifelong blood pressure control, usually with beta blockers, and regular imaging to watch the rest of the aorta. Because dissection can run in families, current guidelines suggest imaging for first-degree relatives, especially when dissection occurred young. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe, for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.